I want to welcome everybody to Onward Ozarks, a program produced by the Northwest Arkansas Council. I'm your host, Randy Wilburn. I'm excited to be with you. It's 2024. Can you believe it? This year, we're already here, and I'm so excited to get started with another year of Onward Ozarks programs. As you know, Onward Ozarks is a program that is produced by the Northwest Arkansas Council, and yours truly, the host, Randy Wilburn from the I Am Northwest Arkansas podcast. So really excited to be here today. We have an amazing topic, and we have a gajillion people in the waiting room coming in to sit in on this session today. And I think you're going to be really surprised at what you hear today. And we are talking with the folks from Heartland Forward and the Heartland Health Caucus. And for those of you that don't know, Heartland Forward is a policy think and do tank based in Bentonville, Arkansas. They recently released, and I say recently, it was back in December of 2022, but they recently released a landmark report entitled Healthcare Access in the Heartland, right? And just in case you didn't know, we are in the Heartland. How to improve services in rural America. And as a result of this report, so much great information came out around this report. The Heartland Health Caucus was essentially launched out of this report as an initiative to bring together the top public policy decision makers and leaders focused on healthcare in 6 states. So Arkansas, Kansas, Kentucky, Missouri, Oklahoma, and Tennessee. And I mean, how many of you guys know that together we're stronger, right, than separate? And so it's amazing that all of these states came together with the same idea and focus, which is healthcare and how to improve it, especially in the rural parts of our country and especially here in the Heartland. So this caucus serves as a forum to exchange new ideas, to address pressing health issues, and accelerate new and consistent policy approaches across states with the vision to do 3 specific things. Develop proposals to simplify the healthcare system. We all need a simple healthcare system that works. Advance legislation to address Heartland health needs, and champion health as an economic issue. Because if you're not healthy, you can't work. There's a lot of things that you can't do. And so this program is going to be really enlightening for you. And we assembled a who's who of individuals from Heartland Forward that are going to participate today and share what they know, what has come about since that report was launched in December of 2022. And we have with us today Angie Cooper, who is the EVP. We have Blake Woolsey, who is the Chief Communications and Development Officer at Heartland Forward, and Maria Rodriguez Alcala, Director of Programs for Health and Wellness. And ladies, I just want to welcome you to the Onward Ozarks program for January 19th, 2024. Thank you so much for joining us today. And we really look forward to just hearing from all of you. I would just like each of you just to quickly introduce yourselves and just say hi to the audience. So we'll start right with you, Angie.
Hello, Randy. Thank you so much for the very warm introduction. Angie Cooper. I focus in Heartland Forward of thinking about our strategic plan as a think and do tank and how we're a resource for states and local communities. We're doing some great work. We're excited to be able to talk to you today. Someone that is from the Heartland in Oklahoma and has lived in Northwest Arkansas for quite some time. It's just a pleasure to be able to work alongside the Heartland Forward team and tackle big issues that will advance the middle of the country and help change the narrative so everyone knows all the great things happening in the middle of the country.
Yeah, that's awesome. Thank you so much for joining us. And Blake, we'll let you go next.
Well, as Angie said, that so that everybody knows what's happening in the middle of the country and the work that we're doing, that is the privilege that I get to play, is working with all these smart people on our team at Heartland Forward and really being able to tell the story of all of the great work that we are doing, really as a differentiated think and do tank, because that is different in many cases. And I'll talk about that in just a few minutes, really about what makes us different in this realm and the work that we are doing, in addition to all this work that we're doing in the health and wellness space, but even more so than that, really to really help make sure that the middle of the country is successful. So that's the privilege I get to play.
That's awesome. Thank you so much. And then Maria, you're in the trenches. Maria, please introduce yourself.
Thank you. I'm Maria Rodriguez Alcala, and I'm very happy to be here today to share our wonderful story. We love what we do, and we're excited that you also want to hear about it. Good morning.
Yeah, that's awesome. Thank you so much. So listen, as you guys know, if you're familiar with the Onward Ozarks program, I just want to give you a couple of housekeeping rules before we get started. We do have some gifts for you. So I know some of you came just for those gifts. We have some amazing cards from Walmart, of course, that little store that's just up the road from where I am physically in Fayetteville. And we're going to be giving those cards out throughout the event. You must be in attendance physically in order to get the cards. If we call your name and you don't answer, we'll go on to the next person. And we have a very scientific method of how we choose these names. So trust us when I say that we will take good care of you and make sure that you're enjoying this program. But we do have something for you. In addition to that, if you have questions, please post your questions. We won't get to all of them, but what I will do is look at the questions that have a common theme or through line, and I'll try to release those questions to our panelists. We have some amazing questions for them already, which may actually duplicate the questions that you have. So just be patient with us. We'll get to as many as we can, but we think you're going to enjoy this. And I think this is going to be really helpful for you. And again, the idea with this program and Onward Ozarks really is just to, get out and let people know what's happening in our neck of the woods here in Northwest Arkansas. It's one of the fastest growing areas of the country for a reason. It's not just Walmart. It's not just J.B. Hunt. It's not just Tyson or Simmons or any other major company here in Northwest Arkansas. This is a great place to live, but part of being a great place to live is making sure that we cover all the bases. And as you all know, healthcare is one of the biggest bases that we have to cover. So I want to jump in. I've got a question for Blake that we want to start with. Blake, before we begin to dig into the topic of health and wellness, can you give us a little context? Tell us a little bit about Heartland Forward. I know people have heard about Heartland Forward. You've heard about, we know about the Heartland. Who you guys are and what you do.
Awesome. Thank you so much, because this is a story I do love to tell. So this may be your first entree to who Heartland Forward is. And if it's not your first entree, we hope that if nothing else, we're going to reinforce who we are with you so that you could be one of our ambassadors out there talking about this policy think and do tank that's doing some really great work in the Heartland. We just celebrated our 4-year anniversary, Randy, this past fall. And really, we see ourselves as a policy think and do tank. And what does that mean? That means that we do applied research, which is a little bit different than your typical think tank. And the fact that we do this research that's applied, that we want then to inform the programmatic work that we want to do. And in doing that, then it's going to ignite action through those programs in the 4 pillars that we have. And in working in those 4 pillars, we are really trying to fill in gaps, bootstraps on the ground at a local level, because ultimately our purpose is to be a resource for states and local communities in the middle of the country as we define the Heartland. And while we're really hyper-focused today in our conversation on Onward Ozarks, on Northwest Arkansas and the state of Arkansas, we do focus on 19 other states. So our map is from North Dakota all the way down to Texas, going south. Then we go due east over to Alabama. And then we go up all the way through Tennessee, Kentucky, and around Michigan. So really, when you're thinking about the Heartland, we are as urban as we are rural, although we focus a lot in the rural space, simply because there are so many needs in the rural spaces of the Heartland for which we are focused on. And our pillars, just to round this out, so everybody knows that we're going to do lots of conversation around health and wellness today. Our 4 pillars are innovation and entrepreneurship, human capital and workforce development, health and wellness, as we're going to discuss, but then also regional competitiveness. And that's a bit the cradle of everything, because we figure, like, if you have got it together when it comes to innovation, entrepreneurship, human capital and workforce development, and health and wellness, you are probably a very regionally competitive community or state within the Heartland. And we really just simply want to be a resource, focusing on all of those things, doing really good research, but also putting that into action. And that is what is so important and what we feel like differentiates our team of about 20 folks. So in a nutshell, that's us.
Yeah.
Oh, and
No,
we're nonprofit, and we're nonprofit, and we're nonpartisan. So I think that's also very important as a charitable organization for people to recognize.
That is, I think that's a key thing that you said that we need to remind people of. We're nonpartisan, because honestly, health should be nonpartisan
Yes.
as well as all of those other topics and subjects. I actually got to participate in a Heartland Forward program with the entrepreneurship program, and I thought it was fantastic. And you know, a lot of people, I talk to friends around the country that live on the coast, right? And they wonder sometimes, what am I doing here? And then they come and visit, and then they understand it.
And they're like, oh,
And
yes, that's why you live there.
that's why you live there. But here's the thing: what you guys are doing it's so important, because you're helping to catch us up with everything else, the natural beauty that exists here in the natural state, all of the other great amenities that exist here. The idea is that we want to make sure that everybody can live and experience a full complement of life and resources and access to things that people think you don't normally have access to here in the middle of the country.
True. Very, very true. That's much like being able to access high-speed internet. We've put a lot of time and effort. Angie has been a huge lead on this for us, and everybody deserves the privilege of having high-speed internet, because as we started off, there's not a lot in life you can do, whether it's maintaining your health, whether it's being educated, whether it's running your business. You really need access to that. And we have been clearly focused on that since COVID happened, because we're trying to help communities figure out what to do with those infrastructure dollars and be very strategic in how they're going to use it, and making sure that their population can access it.
Yeah, I mean, because even now we're just coming out of a deep freeze, although it's still cold today, but we had several snow days. And as we were talking around, parents were talking with each other, longing for AMI days where students could do their work at home. The reality is that yes, but I have a computer at home for my kids, and I have internet access. There are folks that are in this community that are not far from where I live that don't have internet access. And that is the real conundrum that we face. And until we can get everybody connected in more ways than one, both on the physical level as well as on the internet level, I mean, we still have a ways to go, but you guys are working hard to overcome some of those challenges. And I certainly appreciate it, as I know many in the audience do. So well, listen, Angie, I want to come to you because I want to ask you to tell us a little bit about the work you are doing in the health and wellness space, and specifically in that space, because Blake was kind enough to elicit out the 4 pillars, but we're going to focus on health and wellness. What you hope to accomplish as a think and do tank, right? Because think tanks, when you hear think tanks, you think, oh, these folks are just talking about policy, maybe potentially creating policy, but there's one thing to talk about it, there's a whole nother thing to do it. You guys are walking and talking and doing. So I'd love for you to expand upon that and help our audience have a better understanding of how Heartland Forward is doing that.
Yeah, absolutely. So as Blake mentioned, our whole entire team, we wake up every single day to figure out, how are we a resource for states and local communities? And when we say that, we're talking to governor's offices, mayors, community leaders, business and industry, philanthropy. We really believe the work that we do too is kind of the power of convening and bringing the right people around the table to put some of our research and data into action. So Randy, as you mentioned earlier, we in the health and wellness space, we really look at it as, how do we champion healthcare as an economic issue? That is our core driver and mission, to help lift up states and local communities. And you have to have healthy communities to do anything going forward. And that internet piece is also helpful for telehealth and other things. But so when we looked at, okay, where are we really going to play in this space and be a differentiator, fill in some gaps, and support our states and local communities, we started with a report, and our team of economists and researchers kind of dug in, focused specifically on 6 states in the Heartland, and looked at rural areas. And one of the things that, again, kind of the magic happens when you bring the right people around the table to have these discussions, is the report is qualitative and quantitative. So we went out, not only were we looking at the hard data and love our economists that they know how to do that, and I will leave all that up to them. But Maria and other members of the team led efforts, and we went into these rural communities. So we did 12 focus groups across 6 states, and we talked to the health providers. We talked to the heads of the chamber and said, how are you thinking about healthcare from an economic standpoint? And we brought these people around the table to then match the data and came out with some really amazing, good findings. I will say it's not things that people don't know, but some of the things that we looked at and the data showed there's significant workforce shortages in our healthcare system today. There is a great need for things like telehealth and other policies that were put in place during COVID that, if everyone remembers from a public policy perspective, we had all these emergency orders. Well, why did telehealth work during COVID and now it doesn't work in states today? So we've got to modernize those policies and ensure people have the access to healthcare. And then we just looked also, as we were talking to some of the providers and different people in these rural communities, is there's a lack of dentists. There's a need for maternal health care. We know mental health is really important. So we took then that data in the report and the conversations, and the fun part is now the do. So what are we going to go do about it? And coming out of the report, we're doing a couple of things, and I'll let Maria go in deep on a project we're working on, a model for a pilot for covering the workforce shortages. But one of the things that we're proud of, and it's been really fun to start to build, is what we call the Heartland Health Caucus. So we decided, okay, we've got to have some modernization and simplification to ensure we have access to affordable health care. And so we created this Heartland Health Caucus, which it's we started with the 6 states that we studied in the report, and we brought together a policy director from the governor's office, the head of the Department of Health for a state, and then the leaders both on the House and Senate side. And some of those people might be joining us today, and we appreciate you being part of the caucus. We have close to 25 members. And what's most unique, Randy, and we know this, is sometimes just in states, all those people don't talk to each other. But the fact that we're getting people in the state talking and across other states to share best practices, we're really rocking and rolling on some good initiatives. And the fun thing, the interesting thing is also it's nonpartisan. So you have R's and D's sitting around the table and talking. And then the second thing is when we started talking about what issues are most important, they really all aligned.
Yeah.
So they said maternal health, mental health, workforce shortages, and then through lines, we need telehealth and community health workers. So that's just to kind of set the stage, and we can get into more details on how the caucus is working and some of our other initiatives in the health and wellness space.
Yeah, no, I mean, that's great. And certainly what I want to have Maria do, and in a second, I'm going to announce our first winner. And we have a question that came in. Our first winner is Anna Daly. If you are here, Anna, raise your hand so that our folks on the back end can recognize you and make sure that you get your gift card. But we want to congratulate Anna Daly for being the first winner. And if you're not here, we'll pull another name. But back to this, because this is very important, Angie, what you brought up. And I'd love for Maria to tag team on the back of this, of your response, to talk about it from her perspective about the Health Caucus, how it's come to fruition, which you really described. And then how, what she is seeing currently in its current state.
Yeah, sure, Angie, Randy. So as Angie pointed out, this caucus kind of came about from the report that we did in 2022. So stepping back a little bit from that, If you look historically at all the states, every year we introduce a lot of healthcare legislation. None of it that is strategically thought, none of that is coordinated across agencies, or even less so across states. So the purpose of this is to kind of help be a facilitator, a convener across the different agencies within the states, but also across the states. And as Angie pointed out, we have both parties in this, and not just working together, but excited to work together. That was just amazing when we brought them together, and they were like, we don't want to meet just once a year. We want to meet twice a year or even more. And we'll like, okay, we'll do what we can. We'll definitely bring you together twice a year. So we're bringing them back together in June. The first time they met was in November here in Bentonville. The other thing that we have to look is most of the discussions at the national level, although that is starting to change, has been at the federal level on what we need to do for legislation. And the state level has been kind of neglected for such a long time. Now there are some trackers that are happening, which actually are helping us also. For instance, there is a community health worker tracker that has been put together just recently by the National Association of State Health Policy. So they are partnering with us to help us track some of what's happening with that first topic that the caucus is going to work together. So we brought them together in November, and they decided that the first topic that they want to cover as a group is community health workers. That will be just the starting point. We need to start simple, although this is not a simple task for Heartland Forward. It will involve a lot of efforts in all of the states. And so that's basically our role again, is being a facilitator, a convener for all of these policymakers. As Angie pointed out, from that report, we also, one of the big needs that we found was also, of course, as we all know, the shortages that we are seeing in workforce, and nurses being the primary one right now. Rural communities, of course, are facing this in the most, they're facing this in the most extreme way. So what we did is, this is already happening across the US. We're not doing anything new. What we're doing is we're coming into a rural community, bring them together, again, be a facilitator, a convener, and let's get something structured that can help you with a strategy of grow your own workforce. And we're starting with nurses. This is a program that is funded by the US Department of Labor. This is a pilot, and eventually we would like to, I would say replicate is a risky word in economic development. What we're going to be replicating is not the exact model, but the same approach of coming in as a convener, a facilitator, and structure, and making the local coalition decide what their needs are, and then structure it based on those needs. So those are the two main things. We have other things, of course, coming up. Maternal health, that's going to link also to the caucus. But we are being very strategic in how also we play, because there are so many needs. But one thing I can say is we want the caucus to be a model for the rest of the US. We want to show that there is collaboration happening in the heartland, and then the heartland can be a model for the rest of the US as well.
Yeah,
And
absolutely.
Randy,
Yeah,
Randy,
go ahead, Blake.
Maria, you were talking specifically that program that we're launching is going to be in Poplar Bluff, Missouri. That was one, as Angie mentioned, we did 12 focus groups. That was one of the communities for which we hosted a focus group, and we heard what the need was. So it made sense for us to go into one of those communities and say, okay, let's start with you because we understand your need and how we can help.
Correct. And that is actually in the Delta region of Missouri where this program is taking care. So it has the grow your own strategy, but also income mobility for the students that are going to be participating.
Yeah. And, you know, it's as I think about it, I've had conversations with people like Carol Silva Morales from Upskill NWA. There are a lot of programs that are here that are already working to try to fill that gap when it comes to workforce diversity and workforce development in the healthcare sector and space. And so certainly you need to be aware of who those are. And I always tell people, you can't be the best kept secret out there. You got to get out there and let folks know what you're doing, what's available, because, you know, as I was just talking with Carol the other day, and she was like, we need more people to sign up for our program. They don't know how good it is and how much it can benefit them. Not only does it benefit those that participate in the program, but it also benefits the community at large when we have a larger pool of healthcare workers to pull from. So I think it just works perfectly. Listen, I did have a question, and Angie, I'm sorry, Maria, this might be for you. Katie Reginato Cascamo, and if I mispronounce your name, please forgive me. How does Heartland Forward engage patient leaders, also known as patient partners or patient and family advisors, to inform, policy think, and do health transformation?
Well, I can say we're not directly working with any of those groups at the moment, but what we're doing for sure is, for instance, in all the focus groups, but recently we also conducted interviews in the maternal health with various individuals across Arkansas and 3 other states. They're different from the caucus, but that's how what we did there is we strategically chose people that work directly with underserved communities. And so, like, for instance, in the rural healthcare report, we found that the needs in the rural communities in terms of policy are the same as underserved communities in urban communities. So there's an opportunity there for urban policymakers to work with rural policymakers, which is wonderful because usually we want to divide them, but in this case, we're bringing them together. It is the same thing that we found in the maternal health space right now with those interviews. A lot of OBGYNs, nurse midwives, doulas working directly with women who are at high risk in maternal health and are telling us this is what they're facing, this is what they need. And so we're going to bring all of that into, again, our applied portion that Blake mentioned and try to put it into how we're going to link that to the caucus, or are we going to be creating new programs out of that? Angie, I don't know if you want to add more to that.
Angie, did you want to add anything to that?
No, I think she's exactly right. I mean, it's rural and urban, and what is important, just looking at the state of Arkansas, Randy, to your point, there's a lot of people doing some really great things in Northwest Arkansas. How do we expand that? But really, workforce shortages is an issue across the board. And so we gotta bring all those people together to say, okay, what are the needs in specific pockets? And unfortunately, none of this is a one size fits all. And so you really got to understand your community's needs. And I just applaud the work that's happening with the Northwest Arkansas Council. They've brought in health experts to think about what's the strategy going forward, and even all the way down to, you know, the Ignite program for high schoolers, of starting to talk about, you know, the importance of some of these things. So we are fortunate to be in Northwest Arkansas, but thinking about how our resources can help broadly across the state is really important, specifically in the public policy space.
And Randy, I just want to add, I'm a big admirer of Upskill Northwest Arkansas. I've actually been in discussions with them because I like their model. It is not a very easy model to replicate when you're thinking about rural communities because you need funding for several aspects to cover. So we're looking at that. We're always looking at Northwest Arkansas as a model for different programs that are happening in the region to take it to other parts of the heartland. I just want to point that out because that's in my radar actually right now for the Poplar Bluff model that we have.
Yeah, that's awesome. Well, I'm sure Carol is excited to hear that, and I'm sure hopefully you guys will connect afterwards to discuss this. I'm getting a lot of questions along the theme of partnering up with different organizations and different programs. One specifically came from Rosanna Solis Garcia. Are you partnering with ARCHWA, which is the Arkansas Community Health Worker Association, to be able to track community health workers? They are the ones that are currently certifying CHW in the state right now. And I don't know, are you going down to that level to connect with organizations like ARCHWA?
Yes. And just to remember, we're just getting started. So if it's a specific person that works for that group, like, you're on our list to talk to. But again, that's what's so important. Again, you gotta focus in with the people that are doing the work, and we will have failed if we didn't roll up our sleeves, or if we went into an area of the state and said, here's all your challenges and opportunities, and then we left. No, we want to be right there with those organizations that have started great work. We just want to help show us where there's gaps or where we can continue to be a resource to help move things forward.
Yeah.
And just to add to that, Randy, there are so many things happening on the ground. We're all many times focusing on what can we create, but in fact, sometimes in health is more what can we support and partner with to make it better. And that's the focus with those organizations like the one you just mentioned.
Yeah. Yeah. And I mean, you know, and again, I think it's important. That's why programs like Onward Ozarks are so important, because what happens is you start to connect the dots, right, with people. And so there are people in the audience here. You're going to be connecting with other people that are in the audience, as well as some of these panelists, and as well as with the Northwest Arkansas Council and Heartland Forward to kind of connect the dots within your, you know, zone of experience and understanding, because then you're able to really make some things happen. So Kristen, Rosanna, I hope that helps you out there, and everyone here that has a question, just remember that there is an answer out there. We just have to find it. And hopefully with programs like this and what we're doing and just having this open dialogue, all of you are able to kind of get some of your questions answered, and then new questions may surface because of it. Another thing that did come up, and this is something that I've been thinking about, Kristen Brandon, Dr. Kristen Brandon asked specifically, are there any specific measures or efforts to expand access and health literacy for non-English speakers? And she was specifically thinking about the Marshallese population in Northwest Arkansas, but that could also be the Latinx population here. And, you know, some of those same issues that we're dealing with here in Northwest Arkansas, some of these other states are also dealing with. So I'm just wondering how you guys are discussing that.
Yeah. The beauty of community health workers is that they by themselves are already very diversified. They have to be inserted, immersed in the community. They have to be connected. And many times they have to speak the language. Promotoras are an example of an old, they have been established for many years already as community health workers. They do more than just what the traditional community health workers are doing today, but they speak the language, they understand the culture. So we're not directly involved with them yet. As Angie pointed out, we're just getting started. But that is one, community health workers is going to be a door to that. And again, most of the efforts that we're doing is, again, we have to have partners and representation of the groups that we are trying to improve the quality of life through health and healthcare. And so that's how we have that kind of representation you just asked.
Okay, perfect.
Well, you know, we get questions a lot about sort of what's surprising the discussions that are happening among the caucus members. And I mentioned earlier, it's how they aligned on the specific issues very, very quickly and said, no, we need resources. And I think this is what's exciting about that they voted to and wanted to move forward on community health workers, is because they're recognizing those gaps and seeing that not having trusted people in a community where you can talk and ask questions about your health and nutrition needs, that is going to, if we don't solve for that, that's going to continue to drive up the cost of healthcare. That's going to continue to drive up the state's budget and what they're spending on health. And so it is really exciting to see our elected leaders and policymakers to take notice, to say, no, we need to have things in various languages. We need to be speaking to the communities the way they speak, and so we can help support them in the right way. And so, and then community health workers, you create more of them. Those are new jobs as well. So
yeah.
Yeah.
It's
And
a
Randy,
win-win for everybody.
Health literacy is an issue for almost every low-income community right now, where that is a gap that we need to fill. And we hope that community health workers are going to be the first step to that, if we can do something at the policy level with that.
Yeah. Yeah. No, that perfectly. And I appreciate you, Angie, stealing my question there about surprises that some of the audience might find intriguing. And I think that's important. And again, even just hearing some of this, I know a lot of times we hear about healthcare initiatives, and sometimes we almost get a headache, right? Because how do we get our arms around this whole concept of healthcare for everyone, right? And how do we make sure that everybody's covered? Because if I'm not okay, then my neighbor's not okay, right? And it impacts us all. And sometimes I don't think we realize that, but these programs are important to help us kind of get back to ground zero as we try to push things forward together collectively, not individually. So I think it's important. But Maria, I want to ask you this question because I know this is right at the forefront of your focus and what you're dealing with on a regular basis. But what do you think, in its essence, what do you think the caucus hopes to achieve through this initiative?
We're being very ambitious, but we're starting small and simple. So first, I want to point out, we all know that healthcare is not in good shape in the US. It is not a sexy topic, as you just mentioned, Randy. If you look at health indicators in the US overall, almost every single indicator is going down, unfortunately. Maternal health is the one that has just recently gotten most of the public attention, but what's behind that, it's similar when you look at other things that are happening with health. So if we don't take care of health, what's going to happen is we're going to continue to lose people to the workforce. They drop from the labor market, or their productivity drops. And that impacts our economy. It impacts our quality of life. It impacts how people just live their daily lives, basically, because they can't perform their daily functions as we know. So with the caucus, we want for these policymakers, again, to start talking to each other more, to think about state legislation in a more strategic way, and also to come up with model legislation that, again, can be a model for the rest of the US, and to show that we can make health care better through state policy. So again, we're starting with community health workers. Well, although it seems as a simple topic, it's not. There's going to be a lot of efforts in each one of these states that we're going to have to coordinate, facilitate, and kind of bring them together. But again, it is, can we be as a resource to these policymakers to make them think more strategically, but also from evidence-based research and things that we're seeing already that have been successful in these states or other states that we can expand, replicate, improve, and things like that. So,
yeah, and so and as a follow-up to that specifically, for being a nonpartisan organization, are you running into any challenges with regard to that? And I'm speaking specifically to Angie and Blake, but what are you finding that there are somewhat smooth roads, smoother than you thought they would be when it comes to uniting the aisles, right? And getting the D's and the R's to reach across the aisle and shake hands with each other and come to agreement about the idea of healthcare for all and making sure that all have access to it.
We really, I mean, Maria alluded to earlier, while we meet with them regularly via Zoom, the first in-person meeting, they were excited to be together, and they were excited to come to another location. Sometimes that's easier, that it's not to be in the state house, but to, we always say sometimes if you're breaking bread together or you're at like another convening where you can really have true, honest conversations about where there's opportunities to advance. There will always be different thoughts, but we want diverse thought into the conversation. But we're really seeing policymakers stand up and want to work together on this. What is also not just, from a nonpartisan standpoint, but what's exciting about some of these policies, because there's not a lot of activity happening at the federal level, there is a lot more pressure for state policymakers and local policymakers on things that they didn't have to think about. And we're starting with 6 states, but there's different definitions in each state of what a community health worker is. there will be restrictions of, can a community health worker work across state lines? And so that's also, I think, you know, what some of the folks from the Arkansas members are saying, I want to know what Tennessee is doing, and how do we allow people to work across state lines and really advance? So I think that's also something that's very interesting, that there, you know, the borders are now being blurred, and that's a good thing, you know, for everyone involved in this situation.
And they want to come together and learn from each other. I mean, that I think is the theme that has struck me so from conversations that are coming out of their conversations, is wanting to learn from each other to do what is best for their community.
Yeah.
And Randy, they do love Bentonville, Arkansas, so that helps
Yes.
too.
It does. It
So we're
does.
going to drive some economic development in June to bring them back to Bentonville.
Well, we like to hear that, that's for sure, and certainly, you know, to encourage folks to be a part of what's happening. So, to piggyback on what you just said, Angie, is it not so much that the states have to look to the federal government to provide some additional guidance or create some broader guidelines that then the states can follow, or are the states empowered themselves to do that on their own?
I think we're seeing in many models now, the states are empowered to do that.
Yeah. Okay. That's what I thought. I mean, because, you know, when you think about it, most states want to assert their rights and their ability to be sovereign and to do what is necessary for the members of that particular state. We're no different. Arkansas is no different than Kansas, is no different than Kentucky. But I think it's important to have that conversation. And because you guys are pushing that conversation along, more people that are in a place of power are thinking about it, right? Because that's the other part that I think sometimes people miss, is that because you are initiating this conversation and creating a platform where people can have safe dialogue, people are talking about it more. And that's why this event is so important. That's why what you guys are doing on a regular basis is so important. So we certainly want to see you guys be successful. I have another question that came up, and I see a theme here. And one of the questions is, are there any lifestyle changes or self-care strategies that can help manage, like specifically mental health? And then they also, and I'm gonna piggyback on that with this other question, because they kind of fall in line with each other. Is the initiative looking at some of the other social determinants of health, like food, like transportation, right? Because sometimes people don't have access to get to a health care facility. And so I'd be curious to know, how are you guys looking at those areas? So mental health, specifically other social determinants like food and transportation, and how they impact the healthcare conversation, especially in the states that are part of this program.
And do you want me to jump in on that? Yeah. So all of the above. We found that we all know from research that the social determinants of health are extremely important to our health. There is no easy solution to that. So what we're trying to do is, in each one of these reports, as we go into the communities and we do interviews, we also try to identify who are those champions already on the ground that are doing things that we perhaps need to showcase. We perhaps need to expand, replicate, find support for them if we could, so that we're making a good use of what's already on the ground, rather than trying to replicate things or create new things that may not necessarily be needed. So as you mentioned, one of the examples we found is, in connecting to the previous question we had on health literacy, for instance, telehealth. During the pandemic, a lot of people that were resistant to telehealth in rural communities actually were using telehealth to access mental health therapy. And for rural communities, that's actually a magic bullet, because there's a lot of stigma for mental health. Any kind of people don't want to go to a clinic where people will see them enter the clinic. And so telehealth, if we could do more health literacy, education for telehealth, people will be more actually willing to use telehealth if you help them get started, for instance. There's also other models for telehealth that we have found that are very useful, but going back to the social determinants of health, transportation, we have transportation systems in all of these states happening that are paid by Medicaid. They're not working effectively. There are some models on the ground. We found one in Missouri that was very unique, that was based on volunteers. Usually these are retired individuals that are helping. They're doing this as a volunteer. They just get paid for the mileage, and then they take people to appointments. Sometimes they take them to the grocery store, to the pharmacy. So they're covering different social determinants of health, and at the same time, they're connecting with their community and they feel useful in their community. So there are models already out that we're trying to put together and expose to start thinking about solutions that are already on the ground that we could just basically find more support.
Yeah, I love that. I love that. And that definitely does address a lot of those issues. So I have a question for both Blake and Angie, and I would ask you guys both. But before I do that, I do want to announce we have another winner, and this winner is actually a friend of mine, Elizabeth Prenger. If you're still here, Elizabeth is in the health. She's actually she's in the healthcare entrepreneurial space, but she has a very cool product. I'm not going to repeat the name right now, but it's supposed to work wonders. But Elizabeth, if you're here, you actually won a gift card, so please make yourself available for that. And then the next winner is Lisa Hotson-Pillar, and I apologize if I butchered your name, but Lisa Hotson-Pillar, you are another winner of a gift card, and I've got one more name, and I'll announce that in a few minutes. But back to this question that I have for both Blake and Angie, talk about how you believe this work will make a difference, and how it will be measured, and whether or not do you feel like a timeline is necessary to in order to see some difference or some change, like to set some type of like big, hairy, audacious goal that you try to meet in the next 5 years. How do you believe that this work will make a difference based on that?
Oh, I'm gonna steal from Angie, and then she can expound on it, because I think we have all looked to Angie many times when she's been in front of a large audience saying, you know, when we're no longer saying we're trying to change the narrative of the Heartland. And I think for anybody who's lived in the Heartland, we know, to your point, Randy, well, people come here and they experience it and they're like, oh yes, that's why you live in Northwest Arkansas. When we're not having to explain why we live in such a beautiful place and, oh, you need to come and see us. I think when we're not trying to have to change the narrative, we will know that we have made huge strides. And that is an overall view from our purpose and goal as Heartland Forward. Now, from a health and wellness perspective, as you might imagine, our board of directors have very strong metrics and KPIs for which we're aligning to. And when we meet quarterly, we are really having to show to them, you know, how much money are we raising and who else is buying into what we're doing and what kind of traction are we getting with a program? And with that program, at what point in time can we sunset that program so that somebody within that state is then going to take ownership of that program and make it run? Because we don't want to come and do all this work and then for us to leave and be like, okay, well, that was fun. Let's move on to the next thing. We want it to be sustainable. And then for us to then begin to work on another gap that we know that we can make a difference for a state on, because we know how to convene and begin to help people make inroads on it. So with that, Angie, I'll pass it over to you. What else would you add to Randy's question?
Come on, Angie.
Yes, it's still what I always say.
I was at least honest.
No, and I agree with everything she said. You know, I mean, we do set really clear metrics and goals on all the work that we're doing. In the health space, you know, we do want to ensure that we're helping the caucus pass X number of bills and legislation over the course of the next 3 to 5 years. We also, to just kind of build on what Blake said, we talk a lot about public-private partnerships, and I think those words get tossed around. And sometimes we think we're doing it, but we're really not. And I think that is also we wake up every day and think about, okay, how can Heartland Forward be that resource? How can we create this public-private partnership? And then how do we, if it's working, how do we make it sustainable? And you really got to have the public and private sectors together working and thinking. That's why the Northwest Arkansas Council has so much success, is they really think about how you bring the right people around the table. That's where the magic happens, and that's how you can really get things done. So the power convening, again, sometimes that sounds simple, but it's really not. And so I can't stress enough that we'll be thinking about those public-private partnerships and how do they become big initiatives for sustainable economic growth in Arkansas and across the heartland.
Yeah. And, you know, and it's funny because somebody else brought up a question and it made me think about this. And I think it's Kyle Gates said one thing that they believe could help facilitate rural healthcare coverage specifically would be removing non-competes. And I'm assuming they're speaking of non-competes for healthcare workers. What's your opinion? And are you paying attention to the upcoming vote on banning non-compete agreements? And I know it's several states are looking to ban this. I think even California is looking to do that as well. And they're not necessarily part of this, but specifically in Arkansas, are you guys getting into that level of conversation about things that could improve the overall healthcare situation? Because again, non-competes are a big issue. If I can't go work at multiple places because I have the time to do it, but I can't because one company says, no, you have to work for this provider, you can't work for another. Or if I leave that provider and then don't have the ability to take another job with a company down the road because I have a non-compete agreement tied to my former employment contract. Anybody want to answer that?
Yeah, so I would say, Randy, we have not taken a position or engaged specifically in that issue. Overall, though, as we look at and continue to build upon the work specifically in the health and wellness space, but across all of our pillars, we really want to be the voice for the consumer, for the resident, the person, you know, and so those are the types of things that we'll be thinking about. You know, yes, that's an issue we need to dig in and determine, but today we haven't taken a specific position on it.
Yeah, no, I that's fine. That's totally fine. I just thought I would mention it. And then another one that came up, and I think we've actually discussed this a little bit in the past, and this has come up, and I'm personally going to just kind of share anecdotally, but childcare in Northwest Arkansas, it says so many kids have to go to Little Rock because NWA Children's isn't equipped for any specialty ER or admit visits. Now, if you want to extrapolate that out even further, we are lacking specialists in a lot of healthcare areas here in Northwest Arkansas specifically, just like I'm sure they are in other areas of the country like that we're speaking of that are part of this Heartland Forward program. But we recently the council had on the folks from Awesome, the Alice Walton School of Medicine, and one of their whole goals is to build a medical school where we will create specialists that will be born right here in Northwest Arkansas, not physically born, but born in their profession, and will stay here. And hopefully that's actually a model that can be replicated in other places. Not that every place has an Alice Walton, but it's an idea whose time has come. And certainly Alice Walton and her team at the Alice Walton School of Medicine, they're doing amazing work to kind of make that happen. Will it change things tomorrow? Probably not. But it's one of those things where we have to have patience in this area because we're still growing as an area in Northwest Arkansas. And I'm always amazed when I talk to people that are from here, like I've only been here 9 years, but people that are from here, like I remember when, and it's a lot different, like pre-Bobby Hopper Tunnel, everything was up business 71. Things change. It does take time. And I suspect that as we continue to grow in this area, we're supposed to be 1 million people by 2045. We're going to see some of those things come to pass. I know everybody wants it right away, but it does take time. But I will say this about the Northwest Arkansas Children's Hospital. Unfortunately, I know the insides of that emergency room all too well because I have 3 boys, but it's been tremendously a blessing for me and my family to have that type of resource at my disposal. Thankfully, they don't have any major ailments, but broken bones and what have you. It's nice to be able to go to a place where they see children first, and that is their first order of business. And so I would just say that, it's coming. right? And I'm sure Blake and Angie and Maria can all concur with that, through their efforts and work, through everything else that we're doing, a lot of that is coming. We just have to kind of be patient with that.
I think it would be frustrating, Randy, if there were not a plan, to your point. I mean,
Right.
it's even looking at infrastructure and the way
Yeah.
in which Northwest Arkansas Council has worked so closely with regional planning, and knowing that because we're going to have a population that is going to grow so significantly, that there are we're going to need more roads. And I think that, to your point of patience, is what is going to be important. I think we would be frustrated if we knew we were going to see growth and nobody was doing anything about it. And I love the fact that, as having the council, which I think many communities across the Heartland and otherwise long to have, a collaborative group that's public-private partnerships, to Angie's point, and saying, you know, gosh, we wish we could have this too to help with our growth. And the fact that we're looking to a lot of communities who haven't done it right, and they're feeling their woes because of the fact that they did not plan in advance quite the way we see it happening. So I hope everybody will be patient. We didn't realize I-49 would be I-49 until we're driving up and down it now. You know, and it's like, it took a while, but boy, are we blessed.
Yes.
Well, and
absolutely.
I will say, in the interim though, that's why we've talked a lot about telehealth, but telehealth is important to help connect to specialists when there's not access. And so getting the telehealth policies and regulations right, so those types of services can serve a community like Northwest Arkansas, is so very important. And I'll just make a really quick plug coming around telehealth. And we talked a little bit about broadband and digital skills and health literacy. We are partnering with the American Library Association, and we will be releasing in the next month across the state of Arkansas specifically what we're calling a telehealth module, and it walks you through everything you need to know. Should I use my phone or computer? Do I have the right internet speed? How do I prepare for a visit? How do I know if I have health insurance? And you know what? I learned significant things from the module. And I like to say, you know, I'm living in this space a little bit. So we're excited about that. And that will be another resource that we push across the state for all residents.
I love that. Thank you so much for that, Angie. All right, so we have about 4 minutes left. We have our final winner is Ray Hernandez. I didn't see Elizabeth Pringer raise her hand. Elizabeth, if you're not here, unfortunately, we can't give you this gift card, but I hope you're here. So please raise your hand. And then Ray Hernandez, you are the final winner of a gift card today, and want to congratulate you, all of our winners. The other two raised their hands so far. So thank you guys so much for being here and participating. And those of you, if you didn't get a gift card, we'll get you the next time around. So, Elizabeth says she's here. Thank you very much. So we just have Ray Hernandez to acknowledge yourself. And then I want to end, because first of all, and she said I can say ass sickle because that's her product. And so anyway, it's a hilarious name, but it does a really important it helps women with a really important issue. So thank you so much for what you're doing, Elizabeth. Unfortunately, we couldn't get to all of the questions that we had, but I do want to end with this, and I'd love for each of the panelists to give their response to this particular question, because this is important for our audience listening. So everybody that's listening, I want you to really tune in now with what all three of these women are how they're going to respond. And this question is simply this: if our audience is wondering how they can help, what would you share that they can do? And I'd love for each of you to go through and give your response to that. So I want to start actually purposefully with Blake, and then I'm going to work down to Angie, and then I'm going to end with Maria on that. So Blake, why don't you go first?
Well, we are a resource. We want to be a resource. So the more you're reaching out and communicating with us, the better, because a lot of times, even when it comes to research, knowing what sort of data you're looking for and you can't find, or a synthesis of a bunch of data, is really important. Like, here's a gap and we need help here. That only allows us to be able to do our job even better. And we would love for you to sign up. This is going to be just like a plug from the comms person. We would love for you to sign up for our newsletter. Yeah. We make sure we don't release it until we absolutely have news to be sharing with you. And a lot of times it's a compilation of a bunch of great stuff.
Yeah, perfect. All right, Angie, you're next. We got 2 minutes left.
Yeah, so real quickly, I would say call, text, email us. everything Blake said, and then stay informed and stay engaged and get involved, because it's going to take all of us to push these big issues forward.
Yeah. And then real quickly, what's the website address? Just give it to us over there.
Heartlandforward.org.
Heartlandforward.org, and they can find that that report from December 2022 on that website.
Yes.
Yes. Okay, perfect. All right, Maria, you've got the final say.
My final pitch is be an ambassador to us. We are not a grant giving institution. We're a grant seeking institution. So for everything that we do in programs, we have to do fundraising. So the more that people get to know about what we're doing, the more you're helping us outside. So we can't do it all, but we're trying to be strategic. So if you can help us reach those strategies, that would be amazing.
Right. And I'll piggyback on that to say, and we talked about this in our meeting real quick as we close, the goal of this program is certainly to avoid duplicative efforts in healthcare, in the healthcare space. Our goal is to learn how to collaborate, and that's what these wonderful ladies are doing through Heartland Forward. I certainly encourage you to get involved with them. I hope you enjoyed this Onward Ozarks program. As always, the council really puts on a good show, and I thank all of you for participating. I think we had one of our largest audiences, and you may even see yourself on the nightly news tonight. So congratulate yourselves, give yourselves a pat on the back, but remember that we are still in this race. And in order for us to win it, we have to keep pushing forward. So keep doing that. I'm Randy Wilburn, the host of Onward Ozarks, and we will see you soon. Have a wonderful day and stay warm. Peace.